steroid injections or other treatments. If there's true instability of the spine, which is the origin of the neurogenic claudication or the lower extremity pain that you're experiencing, then we may be even considering a possible surgical evaluation. But as I tell all my patients, surgery is the last option for every patient. I would like them to see at least have attempted physical therapy, medication therapy, very likely been seen by a pain specialist before we even consider this.
Especially when we're talking about the vertebrae, the spine. I mean, it's really, I suppose, the last place that you want to operate. You do it only if you have to. Exactly. Jane is on the line. She has a question for us as well. Jane, you're live with Docs on Call. What's your question?
Hello.
Hi, Jane. You have a question for us?
Hello.
Yes, Jane, can you hear us?
Hello.
I think Jane's having trouble hearing us. Jane, you're live with Docs on Call. What's your question?
Yes. I have a multi-level degeneration disc disease with a disc bulge, and I'm wondering what type of therapy I could do for it.
Well, you know, it depends on the symptoms that you're having, Jane. I do think that starting again, as we talked about, with aquatic therapy or even a land-based physical therapy program, both would be beneficial for someone with multi-level degenerative disc disease. Depending on their symptomatology, what they're experiencing, a physical therapist would be able to outline an appropriate program which would be most beneficial for your back or lower extremity pain.
Okay. All right. Well, we have to take a quick break. We're going to take a short break and then be right back with Docs on Call.
I want more than talk. That's why I did my homework before choosing a hospital, and I found there is a difference in things that really matter, the things that make you safer and get you better faster. I went to ChooseMethodist.com to get the facts, and I found out Methodist ranks highest in our area for quality and service. Because the real measure of a hospital isn't what they say, it's how well they take care of the people you love.
Welcome back to Docs on Call. The number to call, 698-3742. We've got about 5 minutes left, and we can already tell there's been lots of interest, particularly with pain management. When is the time that you say, okay, we've got to do something more than injections, we've got to do something more than physical therapy? It's really just getting to be too much to manage.
I think that that is a different threshold for each patient. And when I speak with patients about, obviously, the next step beyond pain management, which in my opinion would be surgical intervention, it's a comprehensive review of the system. One nice thing about the Comprehensive Pain and Spine Center is we have these monthly case conferences where we review patients, we discuss about the progress with pain management, with therapy, and again, we take a multidisciplinary approach to the problem. Really, for someone to be classified as a surgical patient, in my opinion, unless there is an immediate neurologic injury or current weakness in the lower extremities, if I really need to tell my the last resort. I've tried a lot of patients that I see. I'll see in the early stages. I'll start a physical therapy program. I'll have them see Dr. Begin to have a surgical conversation.
Because the rehabilitation after that surgery, too, we can't forget, is often very painful, and you have to be ready for that as well. So I guess avoiding it if you can
absolutely
is great if you can do that. All right, Doctor, I'm going to have you see if you can help me read some of this again. Is it arachnoiditis? Arachnoiditis for 8 years. Gay had called in with this and has had epidurals. What are your other options? So what are some of the newest treatments that you're using to treat some of this?
Well, I guess my my treatment for this would be, again, to assess what kind of symptoms exactly are you having. And I guess breaking it down into the back versus any radicular symptoms, any nerves kind of being entrapped or anything going down into the extremities, and then focusing on that. I don't know if you have any other...
I agree with Dr. Pavlovich. Arachnoiditis is a very difficult situation to treat. Obviously, this patient's had surgery previously that's very often can be related to arachnoiditis, and truly it's more of an interventional pain standpoint once the pathology begins.
All right, we've got time for at least one more caller, just a couple minutes left on Docs on Call. TC is on the line. TC, what's your question for our doctors tonight? Can you hear us, TC? You got a question for our doctors on Docs on Call? And I'm not sure if TC is still there or not. I will go ahead and jump in here. The notes say here that husband had a stroke in 2000, pain from right hip to his toes. And what can he do to control the pain? Is he able to ambulate, but meds don't help the pain go away? So he's able to ambulate, but not without pain.
Well, the first thing you can do is come see us.
Well, yes.
we can help work with it. I think oftentimes people mistake hip pain for mistake pain in that area for hip pain. There's many sources of pain that can refer down into the hip. So it's important to kind of see everyone in during an examination and really target where exactly that pain is coming from. But if that pain is from the back, that can be targeted as well. We can do many things for hip pain as well as sacroiliac pain. Sacroiliac pain very commonly refers into the same area as the hip does, and it goes into the groin, sometimes down the leg. So it's important to kind of be able to really target it, and then we can offer many things.
Our time is almost up. Quick, about a 10-second answer if you can do this. Difference between fibromyalgia and arthritis. If you were initially talking with someone, what would you tell them to look out for?
I mean, just personally speaking, fibromyalgia and arthritis are quite different. Fibromyalgia implies many different types of processes going on. Arthritis tends to be more...
And you know what? Our time is out. I hate to cut you off. Please keep tuning in for Docs on Call. We will have more next time and answer your questions online. Good night.